Welcome to Informations Everywhere channel. Today is a presentation on typhoid fever. Let's start. Our objectives for this presentation are overview on typhoid fever, mode of transmission, signs and symptoms, diagnostic tests available, treatment options, and how to prevent typhoid. Typhoid fever is a life-threatening systematic infection caused by the bacteria commonly known as Salmonella Typhi. Typhoid is usually spread through the injection of contaminated food or water. That's food or water that contains the bacteria. This infection can affect the whole body and damage multiple organs. Unless treated, typhoid infection can have life-threatening effects. Typhoid fever is common in parts of the world where levels of sanitation and hygiene are poor and there is a higher risk of ingesting contaminated drinking water. An estimated 16 to 33 million cases occur worldwide each year, leading to approximately 216,000 deaths, according to the World Health Organization. Children and younger adults between the ages of 5 and 19 years are at the greatest risk of infection. Children and populations lacking access to safe drinking water and adequate sanitation are at highest risk. Travelers are at risk of developing typhoid fever in many typhoid endemic countries, particularly in Asia and sub-Saharan Africa. Elsewhere, travelers are usually at risk when exposed to low standards of personal hygiene or food hygiene and poor water quality. This shows how serious and deadly typhoid fever can be. Mode of transmission, or how one person passes the infection to another person. Typhoid is a very contagious and is easily spread through contaminated food or water. An infected individual normally passes the bacteria to the outside environment through the feces and more rarely through the urine. It means the bacteria are in the feces of the infected individual, and by any means, either through houseflies or other means, the particle of the fecal component enters your food or water, then you stand a chance of contracting the infection. We say typhoid is a fecal-oral, meaning the bacteria moves from the feces to the mouth. Signs and symptoms of typhoid. Fever that usually reaches 39 to 40 degrees Celsius. Headache and muscle pain. Abdominal pain. Nausea, vomiting, constipation or diarrhea. Fatigue or loss of strength. Loss of appetite. You should note that malaria and typhoid share similar signs and symptoms. Still on signs and symptoms, there is rash in some cases, not all cases of typhoid. And also, severe cases may lead to serious complications or even death. Laboratory investigations used to diagnose or confirm typhoid. Typhoid is diagnosed using laboratory tests, one of which is the radar test. The radar test is an advanced way to check for antibodies that your body makes against the Salmonella bacteria that causes fever, the typhoid fever. The test may not always be positive despite the presence of the infection, as the test has a poor sensitivity and missing approximately 30% of positive infections. Still on laboratory tests, more reliable and also faster tests include IDL-2-based tests, which can detect antibodies against the infection within minutes. Another more reliable test is the Typhoid test, performed using a blood sample. This test is easy to perform and does not require any special equipment training for the staff. Please note, all the tests should be done by professionals and should be done at the laboratory. How typhoid is treated. If typhoid fever is detected early, it can be treated quickly with a course of oral antibiotic. However, serious, more advanced cases may need to be treated with intravenous antibiotic in a hospital setting. In addition, increasing antibiotic resistance is making it easier for typhoid to spread and more difficult to be treated. This is trying to tell us that we should not self-prescribe any antibiotic medication for ourselves. We should wait for a physician or our healthcare provider to prescribe any antibiotic for us. Still on treatment. Even after symptoms pass, approximately 2 to 5% of cases become chronic carriers and spread typhoid through ongoing fecal shedding of the bacteria and contamination. It is important for people being treated for typhoid fever to do the following. Take prescribed antibiotics for the full prescribed course. Take prescribed antibiotics for the full prescribed course. Wash their hands with soap and water after the bathroom, and avoid preparing or serving food to other people while the infection persists, and have their doctor test to ensure that no Salmonella Typhi bacteria remains in the body. This third point is very important. After taking the antibiotic, it's very important to have your doctor test you to determine if you still have the Salmonella Typhi. How to prevent typhoid fever. The simplest and the easiest way to prevent typhoid fever is by maintaining good personal hygiene and sanitation, and ensuring the provision of clean drinking water. In addition, 2 vaccines are available against typhoid, and these are recommended for people traveling to parts of the world where the infection is widespread. Also, access to safe drinking water and adequate sanitation, health education, appropriate hygiene among food handlers, and typhoid vaccination are all effective strategies for prevention and control of typhoid fever. Just wash your hands frequently using soap and water, running water, and also sanitize your hands and even your phones, any gadgets with you, your tables. To summarize everything, typhoid fever is a life-threatening systemic infection caused by the bacteria commonly known as Salmonella Typhi. It is very contagious and it's easily spread through contaminated food or water, and symptoms include fever that usually reaches 39 to 40 degrees, headache, abdominal pain, nausea and vomiting, and sometimes rash. Typhoid is diagnosed using laboratory tests and not based on signs and symptoms. It can be treated quickly with a course of oral antibiotic, and in advanced cases, intravenous antibiotics are used in the treatment. Typhoid fever can be prevented by maintaining good hygiene and sanitation and ensuring the provision of clean drinking water. Also, wash your hands frequently. Thank you for watching this presentation. I hope you have learned something today. Please like, comment, share, and subscribe to the channel for more educative presentation like this.